Chronic pain is described as pain lasting longer than 6 months, and there are many conditions that may cause chronic pain. We spoke with Dr. Phillip O'Carroll of Hoag Memorial Hospital Presbyterian in Newport Beach, who explains the team approach at managing chronic pain for their patients.
We think about pain as a warning signal. If you have a kidney stone, if you have a broken bone, the body lets you know. It serves a useful biomechanical purpose. Chronic pain serves no purpose at all. It is truly a disease process in and by itself.
We asked Dr. O'Carroll, what are the kinds of conditions that lead to chronic pain?
There are many different types of chronic pain. You could take somebody with rheumatoid arthritis who has ongoing inflammation. You can take somebody with shingles who many months after the lesions have left the body, they're still left with agonizing pain. Or a diabetic whose feet are burning at nighttime. The symptoms of chronic pain are pain, but not just pain. There may be unbearable sensitivity of the skin that we call allodynia. People who have post-herpetic neuralgia or shingles pain find it impossible to have clothing near their skin. So you will find this marked hypersensitivity, perhaps paradoxically, numbness in an area where there's terrible pain. Ideally, we should try to prevent chronic pain by treating acute pain as effectively as we can. Unfortunately, that's not always the case. But for instance, in patients who have shingles, if they treat the pain problem and the disease process aggressively in the beginning, you may prevent it. Unfortunately, once that whole process begins, the brain actually changes, fostering the very thing that you're trying to prevent. So the earlier, the better.
Dr. O'Carroll describes who comprises the team at Hoag.
The treatment of chronic pain is truly, again, an interdisciplinary approach. It is not just cutting out a tumor or putting a plaster on a broken bone. When you deal with chronic pain, you deal with a person. So that again is why the emphasis is on a biopsychosocial approach. If you can treat the nerve pain with medicines, by all means, but you may also have to look at the person's mood, their relationships, how their pain has affected their entire life. It truly needs a team. To paraphrase a famous politician, it takes a village. In our world, it takes a team. When you see, for instance, a chronic headache sufferer, almost never will you see that person coming alone. They usually have a significant other, because that pain has invaded into the life of the other person, into the spouse, into a family unit where the children are often profoundly affected by the mother's headache. So I truly believe that management of a chronic pain problem demands a true comprehensive team approach that deals not only with the physical, but with the psychological and the social aspects of the disorder. Acute pain has yielded to many different techniques, from powerful drugs to wonderful anesthesiology, invasive techniques. But chronic pain bedevils us still. And I think that as we become a bit more sophisticated in understanding the mechanisms of chronic pain, our treatments, both drug and non-drug, are going to be that much more effective.
The management of chronic pain not only involves treating the condition, but caring for the individual's well-being, a comprehensive approach that only a dedicated team of medical professionals can achieve. For the American Health Journal, I'm Laura Windsor.